Thank you for taking my call. Premier Smith, I worked in the healthcare system, and when I was in ER helping out when it was busy, I wondered why there wasn't one more level that the patients could be triaged to. If in the triage area, if the nurse could identify that they weren't as significantly ill as required the acute care, if there could be a standalone but connected adjacent 24-hour walk-in clinic, the advantage to that is the triage nurse liability would be reduced in that she'd know that somebody would be assessing the patient. If there was an accidental misassessment and the patient needed urgent care, they could still be transferred back into the ER setting quickly. And the third thing is that if patients become familiar with the idea that the walk-in clinic was adjacent to the ER, they know how to get to the ER, they could self-identify and say, perhaps I don't need acute care, but I need reassurance. And I felt when I helped out when the ER was busy, I'd be floated down. And I felt like it would take a fair amount of pressure off the ER doctors when they didn't have to deal with patients that weren't as acutely ill. But the triage nurse is not going to extend her liability by turning them away in case there is something wrong.
You're 100% right. I think that there are a couple of our acute care facilities in Alberta, because I remember hearing this model when I was in politics the first time, where they did exactly that, where you have a 24-hour walk-in style clinic, so that if there is a more urgent need, somebody can go over to the emergency side. And if there is a less acute need, then they can come over and to be able to get their prescription or be able to get the throat swab to find out if they've got strep and then be able to get on their way. I think your ideas are brilliant. We have to be creative and we have to be thinking along those lines, because I think what a lot of people find is that if they have a family doctor, sometimes the family doctor is only open during regular business hours, Monday through Friday. So it means that in the weekend and in the evenings, there isn't another option. If you don't have a walk-in clinic in your community, you go to emergency. So the obvious solution is exactly as you say, let's figure out a way to get emergency rooms co-located with those 24-hour clinics, get more of them up and running, and I think we'll do a better job of giving the patients the care they need on site.